I'm Sarah Hallam, Stewart, Change and Improvement Manager with the Perinatal and Infant Mental Health Service. And within the services are three teams. So there's the community perinatal mental health team, and there's the maternal neonatal psychological intervention team, as well as the infant mental health team. So these other two teams support women and partners during pregnancy and also around the time of birth and following birth, who have long-term mental health issues and also who've experienced trauma, birth trauma, and have things like possibly needle phobia. So they can be looked after and supported. However, today I'm going to focus on the infant mental health team. And infant mental health is around the social and emotional well-being of wee ones when they are unable to convey what they're feeling or saying due to their age, and specifically really that is around difficulties with attachment, and that can cause problems with their emotional well-being, and that's likely to affect them as they grow through adolescence and adulthood. So we received Scottish Government funding in 2020 to develop a specialist service, and the team consists of experts from psychotherapy, health visiting, nursery nursing, and speech and language therapy. We also have close links with occupational therapy and with family nurse partnership, and also with third sector agencies in the community to support the work that they're doing. So the aims of the service are to focus on infants to support them to develop an ability to manage their emotions, and many things can get in the way of that. We need to really understand what that might be in order to be able to support them and their parents or carers to work around that. And we do that by direct interventions through appointments with the families, and we also do it through supporting existing services that are out there. We see infants from the ages of 0 to 3, as I've said, with problems arising from relationship issues. And these relationship issues can be due to parents who have experienced trauma, including birth trauma, ongoing mental health issues, violence, drugs and alcohol use, and adverse childhood experiences themselves. We'll also see wee ones if they have unusual behaviours or if they present with developmental issues that might be linked to their attachments. The way that we receive referrals is that we are very happy to discuss concerns with professionals working with infants. We prefer to do this through email in the first instance, obviously with consent of parents and carers, and then we will have an initial meeting with the professional to discuss concerns and think together about how we can support the wee one. If the referral is through health visitors or family nurses, which predominantly they are, given that they're the main person for the wee one, we invite them in the first instance to a meeting with us, and then if we think it's appropriate, we will invite them to submit a referral. And we see infants in Seaview, at the Seaview project in Whiteman's Brae, Kirkcaldy, and also at the Playfield Institute in Stratheedon, where we carry out observations, and we also can do home visiting, and we also can provide consultation to clinicians if it's not the right time for the families for us to be directly involved. I really enjoy being part of the service. It's such a privilege to support infants at a stage in their life when they're really, really vulnerable, and their families. The team is great to be a part of. We share learning through our different areas of expertise, and we draw on each other's strengths. It's also brilliant to be part of the Scotland-wide Perinatal and Infant Mental Health Forums, where there's a lot of shared experience and shared learning and finding out what happens in other areas in Scotland. And obviously also it's really great to be linked in with the other two teams. So as I mentioned before, the community perinatal mental health team and the maternal neonatal psychological intervention team, who focus on wee ones even before birth and in the early days through providing interventions with their mothers and and family members. So it's just great to be part of that as well.